Good evening. This is Dr. John Bennett broadcasting from Miami. We have another in the series of educational hangouts with Dr. Abdul Rana, neurologist from Toronto and well-known Parkinsonism educator. Tonight, Dr. Rana is going to be talking about weight loss and Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett.
Okay, weight loss and Parkinsonism. Let me start off with a question. Is Parkinson's associated with weight loss or weight gain?
When you think of Parkinson's, the first thing which comes into mind is that these patients should have weight gain, because they are mostly they are slow, so they have less mobility. They are sitting most of the day, or they are lying down, especially in advanced phase of the disease. So it comes to mind when you think of weight and Parkinson's that these patients should be obese, especially as the disease progresses. They should gain more weight, but it's the opposite. It usually, as the disease advances, so they may lose weight. So weight loss remains a frequent problem in these patients, especially when the disease is advanced. There are many causes of weight loss. The most important cause is, though, not eating well. So most of these patients, their intake, oral intake is decreased, and there are many factors which can cause this, such as constipation, which is seen in about 90% of Parkinson's patients, and constipation is a major issue, so that decreases their appetite, and also their taste is decreased. In some cases, those patients who have, especially who have right-sided, they are right-handed, and their onset of disease is on the right side, so they get impaired hand and mouth coordination from the beginning of disease. So they have trouble using their right hand. Even those patients who have onset of disease on the left side, as the disease progresses, it does become bilateral. So when the disease becomes bilateral, they become slow overall, and they develop trouble with hand movements and dexterous movements, so using spoon and fork. So it causes a lot of trouble for them to eat and use the spoon and fork. Also, depression is another cause, and some patients may be nauseous, and the nausea could be related to medications, and sometimes nauseous feeling could be related to decreased gastrointestinal tract motility. So difficulty swallowing is also a main issue, and sometimes these patients have trouble chewing food because of swallowing. So all these factors lead to poor intake of food, and sometimes the absorption of food is also decreased because of the bowel action is slow due to intestinal hypermotility. So the food is not being absorbed properly, and in addition, some patients they don't they have dysthymia, they have disinterest, they have lack of interest, and sometimes they're fatigued, they're tired, they don't make the effort of preparing their meals. Suppose if their spouse has gone to work and they have a bit advanced Parkinson's disease, so they would sit and not do the effort of making their food or making nice meals. Of course, this leads to their decreased oral intake. So sometimes we do weigh these patients time to time to see how their weight loss is going. So that becomes quite a frequent problem in patients with advanced Parkinson's disease.
What are the factors associated with weight loss?
There are several factors which could contribute to weight loss, but the severity of disease, the advanced age of patient, and the if they have cognitive dysfunction, such as dementia, or if they have hallucination, later phase of visual hallucinations. So these factors are probably related to weight loss in some reports. And this also suggests that the pathology may not be just the dopaminergic dysfunction. It could be involvement of non-dopaminergic systems. And in some reports, some experts have suggested that because these patients have tremor and they have dyskinesias, which could be quite marked movements, and because of these abnormal movements, patients are using a lot of energy. So their use of energy is more, and they are not driving that much energy from the food. So that could be the reason that they lose weight rapidly. Other factors which can contribute is loss of sense of smell. Of course, if you don't smell nice food, you would not be happy to eat it, because you're not just able to smell or taste it. And other factors could be regulation of feeding and orexin mechanisms, or maybe neuroendocrinology of appetite regulation could be involved. And some reports do suggest that the levodopa may stimulate the growth hormone secretion, which may induce lipolysis, and it could lead to weight loss as well.
Mm-hmm. Okay. What are the consequences of poor nutrition that accompanies weight loss?
Because of these problems like constipation, decreased appetite, taste, loss of sense of smell, poor hand-mouth coordination, depression, dysthymia, fatigue, and bradykinesia, nauseous feeling. So all these factors, so they lead to decreased oral intake of patients. So patients don't eat as much as they should, so they start losing weight. When they start losing weight, they become frail, and it causes failure to thrive. Sometimes they could have nutritional deficiencies, especially patients who are vegetarian. We see that very often. So they have very low B12, and because of low B12, they could run into a lot of problems, such as polyneuropathy, etc. And sometimes the frail patients, they could develop osteoporosis as well. So if they develop osteoporosis, so they could that could lead to fractures if they happen to fall. I had a patient when he was supposed to come for a follow-up in 6 months' time, but he somehow could not come. He was down south. So when he came back after a year or so, he looked much thinner. So he was quite happy, and he asked me. He said, "See, how much weight I lost? I look so slim." Now I said, "Okay, good. That's good. Are you, have you joined any, Weight Watcher program, or are you doing any, exercise or following any diet or so?" He said, "No, I didn't watch, my weight, or did not join any, club, or nothing special. But I just, I'm just, lost some weight, and I look good because I may have been more active." So when we were talking about his weight loss, so his daughter came in the room. She was, behind. So she sat down when we went over history. Then she reported me. She said, "Doc, he's not eating. He just stopped eating. His food is so less. His appetite may have been gone, but he just doesn't like to eat. He eats very little." So then I realized that this weight loss is not related to his exercise or physical activity. He's not just eating. It's due to advanced Parkinson's disease. Then I told him that you need to eat more frequently, and maybe small meals, or add some kind of supplements. And then I told him that this could lead to some complications in some cases. They could become frail and develop nutritional deficiencies.
It seems like with Parkinsonism, you really have to interview the patient's family just as much as the patient almost.
Right. Yes, parallel history is very important. The caregiver and the family members, their active participation in the treatment plan of patient is very important. And the physician and the family members, they should keep the lines of communication very open, and they should have a very direct communication about the patient's condition, their their advancing disease, as well as treatment and side effects, because so many things are so complex. As I said, instead of weight gain, which seems obvious, these patients lose weight.
Well, I know in the emergency room, sometimes we'd have to talk to the patient's family when a man complained of chest pain,
Right.
because he would minimize the pain, and the wife would say, "Oh, you couldn't sleep all last night. What do you mean? What do you mean? It's just a little pain." And you get the true story
Right.
sometimes from the wife. Okay, one last question: how can weight loss be treated?
Yeah. Weight loss is difficult to manage. So you have to address all the factors which are leading to the weight loss, such as if they have trouble swallowing, so you need to address the swallowing problem. If they have subacute weight loss, like relatively sudden weight loss over a short period of time, so or if they have systemic symptoms such as fever or melena or any other blood in stool or chills or night sweats, so then you need to worry about the systemic condition, inflammatory condition, or malignancies. So this has to be looked after very carefully. So in a consultation with a nutritionist is quite helpful, because they can guide patients with the foods which may be less, but they could be high caloric, and they can address the nutritional deficiencies of patients. Sometimes we do tell patients to add Ensure or Boost or Equate. These are dietary supplements which they can take with food. And I usually recommend more than one, because every time if you eat the same dietary supplements, like you don't feel to eat it because it's the same thing. So I tell them to give alternate, that sometimes give Boost, other time give Equate, other time give Ensure. So that usually helps. And increase frequency of meals. Instead of eating twice a day or 3 times a day, they could have small meals, but they could have more frequent meals, so that their oral intake is overall better. But one should also be careful about the excessive weight gain. If patients have, if they have vascular risk factors such as diabetes or hypertension, or if they have heart issues or coronary artery disease, they should be careful about gaining excessive weight. So there has to be a balance between between maintaining a proper weight and intake, nutritional intake.
Okay, very good. So that wraps it up for weight loss. Any closing remarks on weight loss and Parkinsonism?
I think asking about the dietary habits of patients, their oral intake, it should be the part of the screening process, because it's relevant in many ways. First, the patients with Parkinson's disease, they should eat a very well-balanced diet. They should have a lot of fruits, vegetables, and fibers, especially green leafy stuff, because that helps with constipation. So that's very important. And also, sometimes the protein, high protein in diet, could block the absorption of levodopa, so across the gastrointestinal tract. So that should be also included. So there are so many relevant things with diet, that it should be a part of system inquiry in a patient with Parkinson's disease, so that you don't miss weight loss or any other complications with these patients.
Very good. Okay, Dr. Rana, thank you very much, and we'll be continuing this series tomorrow night when we talk another in the series of Parkinsonism educational videos. Okay, thank you very much, Dr. Rana.
Thank you. Bye-bye.
Bye-bye.